doing? Dr. Patino here at the Cosmetic Surgical Center. We're gonna do micro air power assisted. This is like a toothbrush, an electric toothbrush. See how the tip vibrates? So much like a toothbrush, if you just use it like an old toothbrush and you go in and out very fast, there is gonna be bleeding. There is gonna be gum bleeding, right? So the same is true. The fact that you have this instrument doesn't mean that you're gonna use it properly. If I'm started hammering on it back and forth, there is gonna be bleeding. But do you see any bleeding there?
No bleeding. No bleeding.
This is incredible, right? So this is the way we do it in a bloodless manner, and it is important in this case, especially because we are going to do a fat transfer to the bottle, and so we want to transfer fat that is bloodless and oilless, because of course, if there is significant bleeding, then you're not transferring pure fat, you're transferring fat and blood. And of course the blood is gonna reabsorb, and then you're gonna lose the volume on your bottle, right? And you say, oh, it looks great now, but look what happened once all the blood reabsorbed, you know? So, in addition, if you put oil happens when you traumatize the tissues, when you traumatize the fat cell, it leaks oil. When you use very aggressive cannulas or very aggressive motions, there is going to be significant bleeding. Thank you. All right, so this is incredible. So this is a patient that's not really a good candidate for high definition liposculpture, which is what we're going to do. But we're going to try it, and we've done patients like this before. But patients like this usually need, serial liposuction, so she may need another go at liposuction, or a patient may need to have the injections to lose weight. The GLP-1 agonists are very important. So GLP-1 agonist injections, the semaglutide, the tirzepatide is the champion of those medications, and we have seen and done incredible transformations on people that have higher BMIs, So what we're doing here is I'm doing the line, or we're starting to do these lines here for the definition, and then we'll do the rest of the procedure. So we're just going to start a little bit with this line here, right? So I'm going in with a larger cannula, and then I'm going to follow it with a smaller cannula for those doctors watching out there. Thank you. All right, so how do you get these yellow spots, okay? So it starts with the patient. We tell the patient to stop any aspirin-like medications, ibuprofen, herbs, vitamins, and teas, herbal teas of any kind, for 2 weeks before and 2 weeks after the procedure. The surgeon does not give any such thing, no blood thinners whatsoever. The surgeon doesn't give any enoxaparin or blood thinners. And then we do, the most important thing is the tumescent anesthesia. We wait a good hour before we even start, and we tumesce slowly. Thank you.
Okay, so I was just talking to Dr. Patino, and I was telling him when I was in another surgery, the doctor, while he was doing this procedure, there was a lot of red, not very any yellow, which, is bad. So it's very impressive to see all this yellow consistently. So, beautiful work.
Well, thank you so very much. Nice to see you. Dolores, thank you so very much for coming, and thanks for your testimony. It is true. So this is the thing, that it is a different technique. It's better for the patient. It's better for us too, right? Because is it not better for you, Ahmad? Anesthesia provider, Ahmad. How is it better that I do this in a bloodless manner for you as an anesthesia provider?
Well, decreased bleeding increases the positive outcomes for the patient.
Yeah.
So less hemodynamic instability, which basically means that the patient's blood pressure maintains stable. It doesn't drop or require medications and things to bring it up.
Yeah. So you can film him.
Yeah. Overall better outcomes for the patient.
Thank you so very much. Appreciate it. Wow, so look at the color of that fat. It is incredible, not a speck of blood. That's what's gonna go into her buttocks. So bloodless, oil-less fat grafting here at the Cosmetic Surgical Center of Costa Rica. Incredible, thank you. All right, so notice how we're almost done with the procedure in the abdomen part. And notice we're still getting some yellow, beautiful fat, right?
Right.
This is incredible. Look at that. Very, very nice fat, you know. I'm gonna show you what is called the pinch test, okay? So I'm gonna show you the pinch test. So look how we're down to like 0.5 centimeters here. It's incredible, 0.5. Everywhere we go. Look at this, see? See, can you see from that side or no? I'm gonna lift it so you can see. This is just incredible, you know? And still aspirating. Real nice fat. Thank you. Okay, so this is the pinch test. This is part of the surgery. So she's on her side, buttocks are over here. Look at the nice waist we gave her, you know? You're gonna turn to the other side and I'll show you what it looks like. But look at this, we're down to 0.5 centimeters here too. This is her waist. Everywhere we go, look at that. Incredible, see? Incredible. So it's just everywhere we go, you know? It's incredible. Thank you. See?
Action.
All right, and we can do it this way too. I don't know if that's easier for you guys to see from this side or the other side, but anywhere we go here, you know, it's 0.5 centimeters. It's just incredible. So she's down to her bones. I can actually feel her bones over here. Incredible. Thank you.
1.
All right, so notice how she's on the other side. She doesn't have that waist, right? The buttocks are over here. And look, if I pinch, look at all these, see? See, I cannot look at all these. And we already did this part. So it's really this part. This part is already part of the belly. So this is already done. But look at the difference here. See? From here to here. Look at that. See? All of these, see? From here, where there is nothing, to here. Look at that. Huge, huge difference. So that's, we're gonna give her the nice waist in this side too. Thank you.
1.
All right, so notice how she's on the other side. She doesn't have that waist, right? The buttocks are over here. And look, if I pinch, look at all these, see? See, I cannot look at all these. And we already did this part. So it's really this part. This part is already part of the belly. So this is already done. But look at the difference here. See? From here to here. Look at that. See? All of these, see? From here, where there is nothing, to here. Look at that. Huge, huge difference. So that's, we're gonna give her the nice waist in this side too. Thank you. So these are the buttocks over here. She's on her side. Notice now the nice waist. Now it comes like that, not like that. And look at this, see? This is 0.5 centimeters everywhere we go. This is the belly over here. And this is the waist. See, look at this, incredible, see? You can go all the way over here. And everywhere we go is the same, see? Incredible, thank you. Okay, so notice the nice yellow fat, that's the graft that's going in, is bloodless and it is oil-less. And we're doing these under ultrasound guidance according to the guidelines of the World Association of Gluteal Surgeons. So I'm looking at the patient, I'm looking at the fat that's going in, and I'm looking at the ultrasound. Thank you.
Guided gluteal fat transfer. This is the patient's skin. This is the superficial gluteal fascia. This is Dr. Patino's cannula with the point right here. Perfect, the tip. And then right underneath that we have the deep gluteal fascia. So this is the deep subcutaneous space in which Dr. Patino can put fat, because this is the striated muscle and that's where we do not want to be putting any fat at all.
Hey, how much is that deep subcutaneous space?
How
big is it?
Yeah,
it's very tiny.
It's tiny. It's not the tiniest we've seen. It's more than a centimeter for sure, because this is 5 centimeters here. So we have 1, 2, 3, 4, 5. So we're looking at 1.5 centimeters maybe.
Wow, that's tiny still. Alright, so tell them what we're going to do right now.
Alright, so what we're going to do, or rather what Dr. Patino is going to do, is he's going to give us a bolus of fat right here in the deep subcutaneous space underneath the superficial gluteal fascia, but above the deep gluteal fascia and the muscle.
And what's going to happen?
So we're going to see gray, and what that is the fat entering the space and being represented as gray on the ultrasound.
And the deep gluteal fascia is going to be pushed down,
That's what you're gonna see.
and the superficial gluteal fascia is going to be pushed up.
Just a little bit, yeah.
So a little bit, and so you're going to see that space, deep subcutaneous space, getting bigger. So I'm going to wiggle the cannula so you can see the cannula
So
right
the
there.
cannula's
See that
wiggling, you
bright
see this-
structure?
Yep.
That's the cannula. So I'm going to start 1, 2, 3, go.
All right, and as he said, we have that gray cloud of fat entering the space. And see how the deep gluteal fascia is getting pushed down? That's because fat is entering this deep subcutaneous space and literally pushing it down as fat enters.
And we'll do it again.
So now we have more of that gray cloud, and we have more fat coming in, pushing down on the deep gluteal
And
fascia.
let's do it again. So I go in a retrograde manner, meaning that I inject. Wow, so we're doing ultrasound guided gluteal fat transfer here at the Cosmetic Surgical Center for Cerrito. Look at that bloodless, oil-less fat graft, and I'm looking at the patient, I'm looking at what's going in, and I'm looking at the ultrasound. It's just incredible, beautiful, beautiful. Look at that beautiful